In 2008, Planned Parenthood of Alaska, Planned Parenthood of Idaho, and Planned Parenthood of Western Washington merged to become Planned Parenthood of the Great Northwest. The changing healthcare landscape, as well as legislative and organizational challenges, prompted the leadership of each of the three affiliates to work together to ensure a strong future for the organization and its mission.
In healthcare, there has been a perfect storm in the last few years. Healthcare costs are on the rise. The economies in all of our states have really suffered. So low-income people that used to be funded by states, not well funded anymore. So the bottom has dropped out of mechanisms to care for people and ways to pay for that. At the same time, people have lost jobs and the need for healthcare has been ever greater. So all of those things come together in exactly the wrong way. And it really requires a lot of innovation on the part of a board of directors to keep an organization whole as it moves forward.
For the boards of Planned Parenthood of Idaho and Planned Parenthood of Alaska, the decision to merge wasn't so much about financial necessity as a strategic imperative.
We were really a very financially stable organization. However, we were really a small organization. So we probably never had the resources, for example, to implement the electronic medical record, which in today's healthcare environment is very much a necessity.
The Alaska board was excited about the possibilities that merger would bring to our small affiliate. We had a lot of things on our strategic plan and a lot of pieces that we wanted to put in place that we just didn't have the manpower or the infrastructure to do.
But merging to become a large three-state healthcare organization was not without risks. A chief concern for board members was balancing the support and ties to their local community with the needs of the larger affiliate.
One dynamic of the merger, we were concerned about making sure that there was fair representation from each state, but at the same time that we had to think of things as a whole rather than as each state.
We have all of us kind of coming together thinking of our own states, and now we have to think of us as a three-state organization.
If we're going to continue to be successful and grow our mission in a very rapidly changing healthcare environment, that PPG&W must think and act strategically on a global basis and an agency-wide basis, but we have to then translate that into effective action at the local level.
The merger has been an opportunity to take advantages of increased size, share best practices, and adapt various business models.
The key behind a merger is to build on the synergies that and the economies of scale that a single organism can bring.
As far as in Idaho, we have, or before the merger, we had no federal funding. We don't have any state funding. And Washington was operating under a very high percentage of public assistance. So we've been able to merge those business models.
In these times when not-for-profits are so buffeted by financial challenges and budget cutting and really difficult environmental challenges, it's easier to run a stable not-for-profit that routinely serves its mission as a larger organization than as a smaller one.
Each affiliate had something unique to bring to the table, and coming together as one brought numerous benefits.
The merger's been great for Alaska. For one thing, we had been wanting to open a clinic in Juneau, and Planned Parenthood of Washington was able to come in and help us acquire a building, and then we were able to open up a clinic in Juneau, which would not have happened.
We had a very small education department in Idaho that was really centered in the Treasure Valley, Boise area. Now with the merger, we are able to add educators in other parts of the state, really being able to learn and grow and benefit from the successes that Western Washington had in their education department.
Without the merger, without us coming together, I really don't believe any one of the affiliates, even the largest one in Western Washington, would have been best able to serve the patients and meet the needs of the future.
For over 75 years, Planned Parenthood has been building healthy communities in the Pacific Northwest. The strategic leadership of the PPG&W board will ensure that the organization will survive and thrive for generations to come.